What is the ideal active patient count when analyzing a practice that you might want to buy? The magic number here is about 1,600 to 1,700 active patients in a dental practice you want to buy. How in the world did I come up with that number? The general rule of thumb when buying practices is you want 900 active patients for every $500,000 in collections. My general rule is that practices worth looking at collect at least $750,000 a year as a minimum. I like 800, 850 plus. If the rule of thumb is 900 active patients for every $500,000 in revenue, and I want you to collect 800, 850, somewhere in that range, that means, generally speaking, you need to be looking at a practice that has an active patient count of at least 1,600 to 1,700 active patients. Now, like I do in a lot of my videos, this is the classic case where context matters a ton. I'm going to tell you a story at the end of this video that is super sad about someone who didn't understand this concept. But before I do that, let's talk about the meaning of active patients. When is a different number appropriate, and the context that's going to matter a lot as you look at this number. The first thing to remember is that the term active patient has no universal definition. No one has sat down and entered a Wikipedia entry for dentistry and said, active patient means this. There are all kinds of rules of thumb. I've heard anyone that visits the practice for 2 recall cycles. I've heard anyone who has visited the practice at all in the last 5 years, and then everything in between. Generally, what I think most people mean is someone who has visited the practice at least twice in the last 2.5 years. That's a definition of active patient that I've heard a lot, tends to be what most people refer to when they're talking about active patient, and you can use that as a general rule of thumb. Active patient really is just a term that means how loyal are these patients to this office. And obviously, the higher the number, the better if you're buying the office. Because when you're buying a dental practice, what you're paying for really isn't the equipment in the office or the location or the paintings on the wall. What you're really buying is the goodwill, represented by the habits of the patients, the relationship those patients have with the staff, so on and so forth. So active patient is kind of a proxy to tell you how loyal the patients are to this practice. Another bit of context that's really important here is to think about what a really high number would mean and what a really low number might mean, right? You can look at practices that have an active patient count of 3,000, 4,000, 5,000 active patients and think, oh my gosh, this is a goldmine, this is amazing. And then you go look at their financial statements and you see that the practice collected $767,000 with 5,000 active patients. And that starts to set off some alarm bells. Why in the world would they only collect $767,000 with 5,000 active patients? One reason might be the definition doesn't make any sense. They're using active patient to mean something different than what you have in your head. Another reason is that this practice is really good at getting patients in the door, and they're terrible at keeping patients loyal to the practice. Maybe they do Groupon, maybe they do some kind of sale, maybe they give out free x-rays and cleanings, and then the office is actually terrible and people don't want to come back. So even though the office has 5,000 active patients, maybe that's a practice you're not interested in buying. Another possibility with a really high number is that the front desk, whoever is running the software in the practice and keeping track of entering information for patients, is doing a terrible job, right? Maybe they haven't archived past patients, or they've set up something in the software to keep patients active when in reality, those patients don't consider themselves patients of this practice. A high number can also be a sign of potential in this office. If you see an active patient count of 2,500, 3,000 patients, and a relatively low collections number, this might be an indication that the seller is just doing a lot of hygiene checks, doing a lot of watch and waits on different caries, and doesn't like to put crowns on teeth for whatever philosophical reason. If you line up close enough with the seller's clinical philosophy, but you know that you'd be slightly more aggressive or that you can do a better job at patient care, well, fantastic. Now you have a loyal group of patients who over time you can start to talk through why a different approach to dental health might be a little bit better for them in the long run. And you can put more money in your pocket as you do those procedures. So that's what may be happening with a high number. But what about a low number? A low number oftentimes sets off wild alarm bells for buyers. They'll see an active patient count of 1,200, 1,000, even the dreaded triple digits. 950, 850 active patients. And the buyer, perhaps correctly, starts to say, why in the world would I buy this practice if there are only 850 active patients? The bias is probably a good place to start. Generally speaking, more active patients are better, as long as, again, we have the definition of active patient correct. A low number could indicate any number of things. Similar to with a high number, if the practice has drawn a different box around what they count as an active patient, and they only consider patients who have maybe active recall on the schedule right now as active patients, well, I think most practices would fall in the triple-digit range. A low number could also indicate an incredibly loyal set of patients. Patients that are incredibly loyal to the location, to the staff, perhaps the doctor, something to ask about, but it isn't always a red flag. Maybe these patients come to the office for a very specific set of procedures that this office is the very best at. And these patients know they can only go one place. And you're the doctor that wants to do that procedure. I once worked with a buyer looking at a fantastic practice in Florida. The practice collected in the mid-800s, but what was fantastic about this practice was the overhead. The overhead of this practice was 39.6%. Now remember, in another video I talk about average overhead. Overhead is how much it costs to run the business. The average overhead is about 61.7%. This practice had overhead below 40%. That means that if the doctor collected $100, it only cost less than $40 to run the practice, and the doctor got to keep $60 plus of every dollar collected in this office. This office was a gold mine. The buyer became interested, looked at the practice, loved the physical facility, the operatories looked great, seller philosophy lined up, it was in a city the buyer wanted to live in. Everything looked good for the buyer, until the buyer asked for an active patient report. The active patient report came back, and this seller had 962 active patients. The buyer was expecting to see an active patient count of 1,600, 1,700 in that range. This buyer got, understandably, very, very nervous. 962 active patients, wait a minute, what am I actually buying? The buyer refused to do any other research. The buyer just looked at that one number, threw up their hands, and walked away from the deal. No joke, no later than 3 days, that seller had another buyer at the table with a letter of intent at full asking price, and the buyer who bought that practice, I'm sure, is doing very, very well for themselves. I was the one who analyzed the practice, and I can tell you that a low active patient count in this practice wasn't necessarily the red flag that this buyer thought that it was. The poor buyer is still looking for a practice. I feel bad that I wasn't able to educate this buyer as to the context with an active patient count. So active patient count is important. However, you always have to remember that active patient count is just a check figure. Active patient count is a way to orient yourself around the culture of the office. What type of patients come in? What types of procedures are they doing? How loyal are these patients? And how often do they come back? And are they loyal to the practice, to the staff, to the location, to the doctor themselves? Active patient count is something that just gives you an indicator to go ask more questions. Active patient count generally isn't a deal breaker one way or the other. The deal breakers are things like location, collections, overhead, production. These are the types of things that can kill a deal. So don't let yourself be the type of buyer that walks away from a practice not knowing anything because they expected to see a high active patient count. But don't make the mistake of not looking at active patient count. Just remember, there's a lot of context around this number. If you need help analyzing an active patient count in a practice you're looking at, feel free to shoot me an email, schedule a call with me at your convenience. I talk about this story and several others in my free podcast that you can find, Practice Purchased, if you're searching for that. And you can find all these resources, including my calendar, on my website, dentalbuyeradvocates.com.